Chuck, on top of all of the COVID-19 concerns in our state, Indiana is now reporting our very first case of a strange illness that's now linked to the coronavirus, and it's causing some very serious health complications in children across the state. Tonight, our Emily Longnecker tonight warns and shares the warning from Riley doctors to protect Hoosiers of all ages.
It's called multi-symptom inflammatory syndrome, and it can show up in children weeks after they've had COVID-19. Indiana now joins more than a dozen other states with at least one case. The announcement came at the governor's Monday briefing.
This is a very serious condition which is similar to what we call Kawasaki's disease.
Like Kawasaki disease, named for the Japanese doctor who first described it in the 1950s, this condition involves the inflammation of several organs.
It's a serious problem, and no question about it. Some children have got really sick with this condition, and some children have died of it.
But Dr. John Christensen, Riley's medical director of infection prevention, says while they see about 25 patients a year with Kawasaki disease at Riley, multisystem inflammatory syndrome is much rarer.
This is not something that even if you had COVID, it doesn't mean that it's going to occur.
Still, Dr. Christensen says it's important for parents to be aware of the symptoms, even if their child never showed any signs of the COVID infection.
And it's very important to keep an eye on any abdominal pain, belly pain that is very abnormal, vomiting, and respiratory problems. And if they're having fevers that are not controlled with Tylenol or some other medication, that they have inflammation that involves multiple organs, they have some inflammation involving their heart, but there was no strokes, there was no heart attacks. Some of these children develop respiratory difficulties, and this child had that.
The good news, the child at Riley responded to treatment to reduce the inflammation. And while Dr. Christensen says we could see more kids develop the same condition with more cases of COVID, his bigger concern is infected kids that could spread COVID to more vulnerable adults.
They're going to be spreading it to adults, okay? And they're going to be spreading it to grandpa, and they're going to spread it to grandma. And they're the ones that are more likely to have complications and are more likely to die of it than any child.
The first child diagnosed here in Indiana started out in the ICU unit at Riley Hospital for Children. Doctors say that child is now out of the ICU unit and getting better. No word on when they could be released. Andrea?
Emily, thank you so much. And for the full list of symptoms to watch out for, just go to WTHR.com. There we have this story posted for you right now on our homepage. Again, that's at WTHR.com.
Tonight, here's a chance to look at the numbers. Across the state, there are 28,000 cases of the coronavirus. Most of them are right here in central Indiana. There are 7 counties across the state that have at least 1,000 cases or more. Then most of the cases you'll see are right here in Marion County with 8,400 cases. Johnson County, just to the south, just over 1,000 cases. Hendricks County, 1,039 cases. Hamilton County, Carmel, Fishers, Noblesville, 1,000 cases. Let's go up to the region. Up in Lake County, 2,800 cases. That's the number 2 county for cases right now. Cass County has got 1,500 cases. That's the home of Logansport. Allen County, Fort Wayne area, 1,033 cases. So now let's put in context what these numbers really mean. Part of the increase that we see right now is due to a rise in testing. You can see last week we finally reached more than 6,000 tests in a single day. And we expect the numbers for the last few days to keep rising as the reports continue to funnel in. And despite the increase, the average number of new cases is actually flattening, going down a bit. You can see we reached a peak in our 14-day average. That was a couple of weeks ago. And here's another promising sign. The rate of cases is going down, meaning of the 183,000 tests, 28,000 cases were positive. This rate is about 15%, and that's down from the number that we had a couple of weeks ago that was 19%.
Morning. Marion County leaders will update all of us on the process to finally reopen restaurants as well as businesses. Now, tonight we do outdoor dining. They can reopen this Friday. And city leaders are very fast tracking some of those permits to extend that opportunity to dining destinations without the outdoor seating capacity. Now, several major streets are going to close on Friday. That's going to give restaurants more room to move their dining outside. That includes Mass Ave, Georgia Street, Broad Ripple Avenue, and even Illinois Street downtown, just a few of the areas that are closing temporarily. And also, restaurants can also use nearby parking lots as well as sidewalks. Now, these changes are expected to last until Marion County eases some of those restrictions on indoor dining. We expect more specifics tomorrow morning during the announcement. Again, that's tomorrow at 10:30 a.m. Meanwhile, restaurants outside of Marion County, they are already starting to rebound after getting the option to reopen about a week ago. Our Karen Campbell tonight shares some of the success stories we're already seeing and hearing in Hamilton County.
Staff at Mateo's restaurant in Noblesville are eager to prepare dinner. The spread of coronavirus shut down businesses for nearly 2 months, but now guests are back in dining rooms. Monday starts the second full week of operations. Adson Franco is co-owner. He says the first day they opened, no one knew what to expect.
I can relate to my very first day in the industry, 17 years ago, my first day at the job.
But as days and time passed,
Based off the first week, we're very optimistic that things will get back on track.
guests welcome changes like single-use utensils and paper menus, even sanitizer stations. All staff must wear masks. Around the corner at Grindstone Public House,
we actually had 50 to 60 reservations on the books, and we went on a slight wait on Monday.
many tables moved, others X'd off to keep with social distancing requirements. The company was able to hire back all of its staff.
We're trying to make the best out of the situation. With us having the staff come back, it has been a little bit of a challenge to make sure that we're being able to provide them with enough income and enough hours to make it worth their time to be back at work.
Back at Mateo's, as things slowly get back to normal, Franco says he hopes this is the start of something good.
We can't afford another shutdown. That's the only concern we have. Hopefully the cases won't go up, that the government is going to mandate us to shut down again.
Now, the next big milestone for these restaurants is June 14th, when the state hopes to move into stage 4. Now, the goal then is to allow 75% capacity at restaurants across our state, with the exception of Marion, Lake County up north, and Cass counties. They are now on delayed schedules.